Hello, everyone. Good to be here. Amazing weather today, actually. Before I actually start about how we are revolutionizing healthcare data and like data sovereignty of patients, how many of you here are actually like digital nomads traveling around? Probably most of you, actually. When you have health problems in countries that you are not like born into, you're not resident with, what kind of like fears you have, Basically, if you have some kind of sickness when you're traveling, you somehow feel the urgency to go back to your home country, right? Not because the medical institutions in that particular country is bad. It's more like you have a fear that whatever data concerning you in terms of your health is not really transferable across countries, so that the medical institutions you're visiting may not really know about the conditions you have, allergies you have, all those kind of data concerning that might be pivotal to your their treatment. So what we're building here concerns people's everyday life, because the fact that data is not transferable across different hospitals doesn't only happen across countries, actually happens inside the nation within itself. So for example, if you visit a hospital A and get diagnosis, you have to actually bring it out in form of a document or CD and give it to another hospital to be able to transfer the data. And we are making this digitally possible. So let's see how we do it. So Hippocrat has been around for a while. We actually, we are a project that I CO'd in 2018, and we are currently partners with two of the top 5 major hospitals in Korea, and we are actually onboarding 4 million patient records to next year. About 1.5 million of them will be updated every year, because in Korea we have a very specific policy for corporates to provide health check benefits to their employees, so that people go to get a health check every year or two, which is kind of a rare case in the world. So we currently already have over 150 patients using our protocol to own and manage their data, but they don't really know about it because it's in the back end. We work with number one health check provider in Korea called Southcare, and Asan Medical Center and Catholic Medical Center, which are the 2 top 5 medical institutions in Korea. What we are trying to do here is we are aligning, so whatever information you gain from your, whatever data that's generated by your diagnosis or treatment in hospitals, they usually stay in the EMR servers of the hospitals. When you request them, they don't really give you out in a format that could be easily interchangeable across diverse medical institutions or healthcare providers you'll be running into. They'll give you in an antiquated format of documents or CDs, and a lot of the important information regarding your health is omitted in that process. For example, when you go to doctor and you ask for certain advices, doctor will tell you, and they'll write it down in the EMR service, but that doesn't get transferred out in form of a document. So your healthcare data is always, in most countries, is fragmented and siloed in different servers in different hospitals. And what we're doing here is we're trying to create a protocol where people can save this through their DID and store it and own it and manage it according to their needs. So what's happening here is that you have various sources where healthcare data is created, your hospitals, or you do annual health check, or you have your wearables measuring your biometric data every day. And then our protocol help you create a DID based out of your personal information. We verify it through ZK proof, and we don't save the personal data. And your data is then formatted and redacted, so it's de-identified, so that even if it's lost, it doesn't affect you. It's encrypted already. And we process data to HL7 HIPAA format, so that it could be transferred across countries without getting lost in translation. And we tag it so that whoever needs the data for research and development and might want to buy it can easily identify the data that they want to buy. So that way, we prove your identity through DID, and our data is saved in IPFS. So that's where we are using Filecoin's protocol. So our healthcare data and the tag-related vectors, all those kind of important information is saved on either decentralized server, depending on your needs on your device. And this could be easily traded, and your record of the consents and record of the transactions are on-chain, while data is off-chain, so that when you consent to sell your data to insurance companies or pharmaceutical companies, all the records of the transactions are recorded on chain, while data is going straight from you to the institutions. For our partners who are working with us, this is a very simple integration, because they don't really have to know about blockchain, or they don't really need to understand about crypto to use our service. We give them a simple API they can implement in their consumer-facing interface, and then we do the rest. We create the DID, do the processing, we do the redaction, and we put the transactions on chain. And most of the users, when they're interacting with the app of the hospital, don't really need to know about what's happening in the backend to actually use our service. So currently, all the users that are using our protocol, they don't even know we actually exist, because on the user-facing interface, it just says, oh, I want to save this data safely encrypted, and they say yes. And then later, when we develop further, they can also check the box that I want to sell this data for profit, and then that's it. They can start making money from their healthcare data. So this is a process we go through. So data comes in, then we do the formatting, and we put vectors for the AI to be able to read it, and then we put in the decentralized storage. So we gather different types of data from different sources. It's like a puzzle. So your healthcare data is scattered across different sources, like your hospital health check results, healthcare apps, or your fitness devices. You can aggregate all those data in a single DID, and then be able to sell it in whatever format you want, or share it in whatever format you want. Maybe to one particular hospital, you want to share your healthcare records and a little bit of your exercise data. To the other service, you want to share your wellness records. And then what we enable you to do is that we have a consent layer that records all the consents you gave out. So it could be in what kind of data, to what extent, for what kind of period, at what expense, and then that comes all the consent list comes, all the data comes to the data pool, and then our buyers can select the data they want to buy. And then when transaction happens, we pay out all the dividends to users and then related partners. What we think is that what we are building here is very important in my perspective, is because all the data, all the innovations in our space, usually in my perspective, is based out of data. And we're gathering and aggregating data that's not easily accessible, even for AI models. Our solution is safe because data is stored in an individual safe that we are creating for everyone, so that when what happened with 23andMe was that somebody might a hacker hacks into their central server and that steals millions of people's healthcare genomic data. For us, it's impossible because they have to hack into millions of data safes individually to be able to get that data. And then it's flexible and private because we separate your personal information and your healthcare data so that it's saved in DID and your personal information redacted and saved in a format of DID, and then we save your medical record in a different storage. We began in Korea and we're now going global. And we think Korea is a really good test bed because we are #1 in the penetration rate for electronic medical records. So that most of our data is digital. So that once we finish integrating with the hospitals in Korea, we actually have plans for integration with hospitals in Indonesia, Vietnam, and US at the moment. We are addressing a fast-growing market, and there is more and more demand for healthcare data because all that data is needed to develop pure innovations in AI models regarding healthcare. Our vision is to be able to help people own and control their data so that they can get personalized healthcare anywhere they go, and they'll be able to monitor their health using not just like doing annual health checks or biannual health checks, but by connecting their data with all the healthcare-related devices or services they use. And then you can actually make your healthcare data actual assets that could be traded and be sold for profit. And you can actually turn your healthcare data into your digital asset that way. Thank you for your time. This was my presentation.